All right. So just a couple of things to talk about to begin with. So the birth experience and that sort of early time post delivery are a really crucial time to get through. There's a lot of emotions running high, there's a lot of expectations, and those are things that are important to work through. So things that might affect you in your recovery might be how your pregnancy was. So did you have any injuries while you were pregnant? Did you suffer from pubic symphysis pain, sacroiliac pain, back pain, or other injuries? Were you able to maintain your fitness? And there's absolutely no judgment if you pretty much gave exercise away during pregnancy, but it just means that it might take a little bit longer to build that fitness back up again. Did you have other problems that might have put strain on the pelvic floor, like constipation, hemorrhoids, or incontinence? And urinary incontinence can be experienced by up to 50% of women in pregnancies, and more so as you have multiple pregnancies. So those sorts of things might give you some indication as to how quickly you can recover following your labour. So now we're going into just looking at the plan versus the reality. So especially if it's your first child, or maybe even you might be shocked after your second or third child, at what is left behind after the baby is out and into the world. So, you know, if you might have problems with body image after having a baby. So again, you might be left with this rather large stomach still, which might take a month or so to come down. You might have a large diastasis. You might have stretch marks, reduced elasticity in the skin. So all of these things can have an effect on your sort of psychological state of mind and body image. And obviously getting back to exercise and getting your fitness back is a really important step in regaining your confidence. And also the fact of reminding yourself that, you know, that's a great sacrifice that you've made to bring another human being into the world. So that's always something pretty special and something to be really proud of, and your body just bears the scars to remind you of that. You know, your age obviously might affect how quickly you're able to bounce back as well. And again, this whole expectation of bouncing back. And so, you know, social media, and we see all the celebrities, and they're looking ridiculously fit and toned and slim sort of 4 weeks, 6 weeks after having their baby. And sometimes we hold ourselves to that expectation, and we really shouldn't, because everybody is very unique. Everyone's situation is unique, and we need to find out the right balance for ourselves. So then we might also suffer from problems unexpectedly of postnatal depression, anxiety, extreme fatigue, sleeplessness, difficulties in juggling your timetable, your schedule, and difficulties in being able to get out for exercise and have time for yourself. And obviously it's really important to make time for yourself, and hopefully you have a partner in your relationship that can help, or some family members or friends that can help you to make time, because often that is worrying. And of course, if you have a baby that's a really poor sleeper, or you know, has other complications, then that's going to influence how much you can prioritize yourself in this process as well. Looking at if you've had a vaginal birth, if there's been use of assistive devices such as forceps or French, which may create a little bit more tissue damage or muscle tearing. If you've had an episiotomy, or if you had tearing, stitches, what degree you had, if you've had a prolapse associated with that. And again, that's something that a lot of women aren't fully aware of unless it's quite a severe degree. So we'll talk a little bit more about prolapses shortly. And if you've had a diastasis, and a lot of people have a diastasis straight after having a baby, and that can be really normal, but they might be told this and be told to sort of avoid abdominal exercises, and be quite frightened about starting an abdominal strengthening program if they have been diagnosed with a diastasis, which is that separation of the rectus abdominis muscle. So just looking at the sort of early times with after having a baby. So if you've had a cesarean section or an episiotomy, all surgical wounds take 6 weeks minimum to heal and continue to remodel for up to 2 years post-operatively. So this is looking at kind of if there has been scar tissue, that scar tissue will continue to remodel, and this is why they will recommend leaving a year or two between pregnancies to allow your scar tissue to reach a good amount of strength, so there's no risk of rupture. And we're looking at sort of early in week 1, so we've just got some general advice through there as well, which we won't spend too much time on. You can go back and review that if you like, but in terms of the exercise, obviously want to avoid heavy lifting, anything larger than your baby. My first baby was 10 pounds, which my husband was stoked with because he thought that meant I could pretty much do everything still since I had such a large baby. And things like avoiding straining when you're toileting, using breathing exercises, drinking warm water, again, getting help from your doctor if you're really backed up. You don't want to be straining when you have such a maybe some weakness with the pelvic region anyway. And then just gentle walking, and those things can really help to open up the bowels, or gentle waddling, as it probably seems a little bit more like in that first week. In the weeks 2 to 4, if you have any scars, then they will be at 20% of its previous tensile strength. So that scar tissue is still really weak and needs to be protected. So some people will use tapes on their skin to help with this. You can get compression garments or abdominal binders or tubular support wraps to go around the stomach, which people use to try to help to shorten up the abdominal muscles again. It's just important to make sure that you have got good pelvic floor control with this, because otherwise it's a bit like squeezing a tomato sauce container and it all just comes out the bottom. So we don't want to exert too much pressure from the abdomen around if the pelvic floor is weak, and it might just take another 4 or 6 weeks before you can wear anything like that. And obviously if you've got a scar, you need to make sure that it's not putting any pressure or rubbing anything on the scars. And it's better to get things that are more built-in sort of underwear going right up to the rib cage rather than just around the stomach as well. In terms of exercises from here, doing the gentle pelvic floor exercises, which we'll run through shortly, abdominal breathing exercises, and so these are really important from day dot, really. So your diaphragm might have been quite inhibited during pregnancy with not being able to expand properly, or not being able to contract properly with having a great big baby pushing up into it. So working on breathing in through your nose, expanding your belly, and then breathing out through the mouth or through the nose. And as you do that breath out, then starting to gently tighten the pelvic floor muscles. And that can just be a very simple contraction. So we'll run through that again shortly. But abdominal breathing is again really important for getting the bowels moving. Obviously train that diaphragm back up again, and also to help to get your rib cage moving again. So what happens is when we're pregnant, the baby and the stomach muscles expand and pushes the rib cage angle out a little bit wider. So normally we look at a rib cage angle if we're looking at the stomach sort of from side to side. We're kind of looking at a 90-degree angle or 45 degrees on each side. So that starts to widen when we're pregnant. So as we use our breath out especially, starts to draw the rib cage back down and in, and then we breathe in, it opens it back up again. So we want to start to get that rib cage narrowing back down again, which is also held in place by your oblique muscles and some of your intercostal muscles. And then we've got your pelvic mobility exercises. So this might just be pelvic tilt. So lying on the back and tilt, rocking your hips backward and forward, arching your back and then flattening your spine. You might also do some sort of circular movements or sitting on a Swiss ball, doing pelvic tilts and maybe doing some light circles, hula hoops as well. And then you start also lying on your stomach. So this is a good way to gently stretch abdominal scar tissue. And again, can be a nice way to do some breathing exercises and feel the expansion in your back. Gentle stretches around the hips, so if you've got tight hip flexors or tight glute muscles especially. Stretching through the upper back, so this is a lot of time spent hunched over sometimes, and not the best set up breastfeeding. So we'll go through in some of our exercises later on, going through some thoracic extension exercises to help with straightening up the back. And then just isometric contraction. So isometric just means doing a gentle contraction and holding that contraction, the muscles not shortening or lengthening during that. So again, we'll go through this a little bit more when we go through the diastasis component. And that's again just learning to contract our abdominal muscles, but without necessarily doing crunches or oblique twists early on there. Week 4 to 6, we start to just gradually increase the walking, start to progress those lower abdominal and hip strengthening exercises, such as pelvic bridges, clamshells. And then at week 6 to week 12, a walk jog program can begin. So if you haven't been doing too much walking, then we'll talk about this in our walking program later, but you'd want to start with a few weeks of getting some brisk walks in first before you start building into a jog. And if you're a bit of a gym bunny, or you're CrossFit or something like that, or competitive sports, looking at progressing back to gym-based exercises, or if it's a sport you're doing, getting back to trainings and doing small amounts of the training sessions or running some drills, and looking at with your gym session, what exercises are safe for you to do. So, you might not be doing skips and double unders. You may not be doing heavy weighted squats or lunges if your pelvic ligaments are still a bit loose as well. And again, it's always important if you are wanting to get back to some heavy training, it's probably getting a little bit more one-on-one advice from a physio or a personal trainer would be advised. And at this stage, you can also start to work on mobilizing your scar tissue. And just knowing that 3 months after an operation, your scar tissue has reached 80% of its previous strength. So even at 6 weeks, it's still, I don't know, probably around 60% or something. So it's still not that strong. So that's why, again, we need to make sure that we take it easy in the way that we progress and know that it remodels for quite some time. So looking at sort of cesarean scars, again, they might take, there might be some numbness around there. It doesn't necessarily affect the way the muscles contract. It can just reduce your awareness of it sometimes, and it can take a year or so for some of that numbness to resolve. And some people might be left with some areas of slight numbness or sensitivity. Again, it's normal to have a sensitivity in the scar, and it's important to break this down. So you can use things like wheat bags, applying light pressure with a Q-tip or soft flannel to desensitize it if it is more sensitive to the touch. If you're a bit squeamish about these things, then you might want to get a partner or again a professional to help you break through some of those barriers. So massage techniques, we've got in the pictures above here, circular motion. So generally when we're mobilizing scar tissue, we don't want to use any cream because we actually want to try to move the skin. We want the skin to kind of hold to our fingers, and we want to try and move that away from the underlying muscle and fascia. And so make sure that we're not getting these sort of, I kind of explain to people, cobwebs sort of growing and developing between the layers, which then restricts the way that the skin and the muscle layers move on each other. And all those things can sort of affect like your posture. So if you've got a really, bad scarring or reduced mobility in a cesarean scar, for example, then you might not feel comfortable standing completely upright, and might be sort of protecting that without realizing that you're doing it. So it's important to make sure that we get these scars moving. So you've got circular motions where you're pressing down and circling around. I will have a blog out soon which has these in much more detail, because I know that not everyone will be able to relate to this. You've got using perpendicular to the scar, parallel to the scar, and then also skin rolling, which is basically pinching the scar on either side with your thumb and index finger, lifting it away from the underlying tissue gently, and then rolling it between your fingers. And you should do that all along the length of the scar. And then after that, you can apply silicone creams or vitamin E creams a few times a day to help with the reducing the scar. And then if you have any perineal tears, which have got stitches or episiotomies, again, one of the things with these ones is, again, it's an area that people sometimes are a little bit squeamish about and don't necessarily know their own anatomy in that intimate detail. So again, there are pelvic floor specialists that can do this. We don't necessarily do this sort of work in our clinic, but some people do need to see someone for this if they're not comfortable doing it themselves, or don't have a partner that might be able to help them with it. But obviously once all of the stitches and things are removed, and again we're going through that six-week recovery period, then we want to make sure that we've got no residual tightness, trigger points around these scars. And again, even if you haven't had any scarring, you might have had a little bit of tearing in some of the muscles. And of course, if we get any muscle tearing in our body, we can get scar tissue and knots and trigger points in it, which can make the muscles a bit dysfunctional. So some of the problems associated with that might be urinary or bowel incontinence or dysfunction, painful intercourse, perineal pain, pelvic floor weakness or dysfunction. You may have referred pain from the pelvic floor. They can refer like into your tailbone, buttock, pubic bone, belly button, and then some pelvic, hip or back pain from again having those muscles ineffectively working. So massage techniques, again, I will have a blog which will explain these in more detail, but they include again perineal rolling, which is where you end up inserting, and the perineum is, if you're not quite sure, is the tissue between your vagina and your rectum. So it basically involves inserting your thumb up to the knuckle into the vagina, pinching the perineum between the thumb and the index finger, and then again sort of rolling that tissue between the fingers. You put pressure into the perineum for releasing of trigger points, and traditional thumb massage, which again can be done from sort of 34 weeks of pregnancy, and then after to just stretch those muscles back out and that tissue back out. Breathing exercises and stretches can also be really effective. So again, if you're not really into getting into that close and personal with that area, then you can still get some effective release with doing some breathing exercises. And again, this can be important. Some people actually grip their pelvic floor muscles too much as well, and do actually need to work on relaxing those. And one movement that I found really useful was to actually hold onto a doorknob. So if you've got the door open, you hold onto doorknobs on either side, and then just basically sit down and back, so sitting back onto your haunches. And in that position, you do some really nice big abdominal breaths, and you really focus on that sort of expansion around your back, the expansion into the pelvic floor, and just imagine it's like a balloon that's sort of opening up, and then using that breath out and sort of feeling that elastic recoil, and then breathing in again. Child's pose, or we call it shell stretch, but child's pose position, sitting back towards the heels and then kind of rocking your hips sort of from one heel across to the other can be good as well. And then you've got your, not supposed to say happy bay, it's supposed to say happy baby. So that's where you line on your back, and you bring your feet up into air and you hold on to your feet, and you kind of gently rock from side to side, and again try to breathe and relax into this position. Pretzel stretches, which is that crossing one foot over the opposite knee, hugging towards your chest. Butterfly stretches, so it's lying on your back or sitting with your feet together and dropping your knees out to the side. And again, those sort of deep crouching, wide-legged crouching positions, squat positions, can be helpful for stretching that as well. Okay, then we're going into, let's see, quick glimpse back on the old poll. Excellent, cool, great. Okay, So a few of you are interested in pelvic organ prolapse. Again, it's a bit of a gruesome picture sometimes. Some people not quite so comfortable looking at these things, but it is very much a part of us that we need to really take ownership of and understand, and really understanding how all of these areas work, and being familiar with yourself is a really important part of managing incontinence or prolapses. So we've got in this picture here, we've got the normal anatomy. So we can see at the front, going from the front to the back, we've got the urethra up to the bladder. We've got the vagina going up to the uterus, and we've got the rectum, which is going to the bowel. So there's sort of three main types. If you've got that anterior prolapse, which is with the bladder dropping down, you can also get just a sort of prolapse of the sort of the neck of the bladder as well. So obviously main symptoms with that would be urinary incontinence with increased frequency as well. And again, you may feel sort of a lot of heaviness or dragging in the lower stomach area. And again, you may feel a bulge through the bottom of the pelvis. Then going down to the bottom left-hand side, the back passage with posterior prolapse with the rectocele, which is where the large bowel, the rectum, prolapses into the posterior wall, the back wall of the vagina. Then we have, and again, people might experience a lot of problems with constipation, or who have had problems with constipation may be at risk of developing this prolapse or edemstic hemorrhoids. So as you have difficulty with straining with trying to go to the bathroom, then it can force the fecal matter to come forward into the vaginal wall. And then you've sort of got the vaginal vault of the uterus starts to prolapse. And again, this can be a higher risk if you have a very quick birth. Maybe you have multiple pregnancies, multiple births. If you have a prolonged second stage of labour, if you have a history of constipation, if you're older, are also risk factors for these prolapses. So it's estimated that as many as 50% of women after vaginal birth will have some degree of prolapse, and as many as 20% of those will be symptomatic. So they grade the degree of prolapse at 4 levels. So basically, 1 to 4. 4 is basically the whatever part of the body is actually coming outside of the sort of vaginal wall. So it's coming sort of outside of the body is sort of the most severe grade, and then sort of 1, 2, 3 is sort of progressive from a little bit of a drop to a little more to normal. And sort of level 3 is kind of level with the sort of the perineal level, and then 4 would be outside. So many people with those higher grades, so grade 4, who have finished having children may have like a hysterectomy or a sling, or have some surgical management as well. But some of the symptoms, again, so a lot of people aren't aware that they have prolapse, but some of the symptoms could be a feeling of heaviness around your lower tummy, a dragging discomfort inside your vagina or in the bowel, if you've got the rectocele, feeling like there's something coming down your vagina. So some people feel like they've got sort of material sort of stuffed up inside of them, or like they're sitting on a ball. Feeling or seeing a bulge or a lump coming out of your vagina, and a discomfort or numbness during sex. They have problems peeing, so feeling like you're not completely emptying your bladder, needing to go to the toilet more often, or leaking small amounts of pee when you cough, sneeze, or exercise. So those are some of those stress incontinence signs that you need when you run, jump, sneeze, cough. Right. So main sort of management for this is sometimes activity modification. Things like checking if it's your bladder that's a problem, trying to reduce things that make the bladder more sensitive. So wine, coffee, tea, and caffeinated beverages can all irritate the lining of the bladder and also are a diuretic. So if you're having those before you go and exercise, then you may be setting yourself up for failure there. And knowing sort of there's different times of the day. So as you're regaining your strength, you might find that if you're spending all day standing up, for example, and you're going to start to get tired, and then going and trying to do some heavy exercise in the afternoon, you know, those muscles might be quite fatigued, and again, you might be setting yourself up for a little bit of trouble there. So learning again about the behaviour of your symptoms and knowing kind of when's the best time to exercise, but knowing how to do your pelvic floor exercise properly is also really important, because if you don't do them and you go out and you exercise and you start to leak, it's a little bit like trying to close the gate after the horse is bolted. It's just a little too little too late, really. What we find is with most of them who experience any type of incontinence, 85% of those can be fixed or resolved with 5 physio sessions. But I'm sure, I'm sure Poise doesn't necessarily want to know that. They pretty much prefer that we just sort of brush it off as light bladder leakage and slap a pad on there and away you go. I'm not saying you can't pads. You're certainly going to save some embarrassment if you do get caught off guard, but it should not be the only strategy that you're having in the management of incontinence. So it starts with the pelvic floor retraining. So looking at the pelvic floor muscles, we're looking at this picture with the view looking from a bird's eye view down into the pelvis, and we can see from the back or from the bottom, we've got the vertebral body going through to the tailbone, the coccyx. We've got a ligament going through to the hole where the hiatus, where the anus sphincter would be. We've got your levator ani muscles wrapping around that, and the pelvic floor muscles are made up of several smaller muscles, which we collaboratively call the pelvic floor muscles. But if we think about the area between our pubic bone and our tailbone, and then the two sit bones at our bottom, that's the pelvic floor. So when we isolate the pelvic floor muscles, and quite again a high number of women will be doing their pelvic floor exercises incorrectly, and in fact bearing down on their pelvis instead of pulling up. So again, it's important to get this right, and if you're not sure, to see a professional. So we want to watch out for any compensations. So this might be clenching your buttock or your hip muscles, tilting and tucking your pelvis, lifting your rib cage up and holding your breath and trying to suck everything up. Those are not correct ways to activate the pelvic floor. So we want to make sure that from the outside, if you were looking in, you shouldn't really be able to notice that you're doing your pelvic floor contraction, except maybe the appearance that you might be lost in thoughts somewhere and concentrating. So pelvic floor contraction, again, if it's early stages, you might want to practice these lying down or side lying rather than sitting or standing. But again, if you need to feel what you're doing, that can be helpful. So sometimes just placing your hand and placing that just on that sort of perineal tissue between the vagina and the rectum is useful, so that when you do your contraction, you can again make sure that you're trying to feel a lifting of that area rather than any type of pushing down through there. So we want to do our pelvic floor exercises. To start with, isolate 3 areas. So starting around your around the rectum. If you imagine that you've got some gas and you're wanting to try to stop that from escaping, you want to start to tighten around the buttholes and gently pull up. You can imagine as if you've got little marbles sitting inside your rectum, and you're trying to gently squeeze and lift that marble up, and it might only feel like you're lifting, a millimetre or 2. That's okay. and then you're going to relax it and feel it just sort of sink back down again. And as you do that, again, there shouldn't be any movement of the pelvis, and you shouldn't be clenching your bottom and rising up and down as you sit with this. Now, the buttock muscles and the pelvic floor muscles are BFFs. So often as we work the buttock muscles and get those stronger, that will enhance some of the strength and contraction of the pelvic floor. However, a buttock contraction is not a pelvic floor contraction. So a buttock squeeze is not a pelvic floor contraction. So we really want to focus right deep under that tailbone and getting that tightening and relaxing. Then we want to move forward to the vagina. So we want to imagine as if we had our tampons or half inserted, or imagine if you were in the middle of the intercourse, that you're trying to tighten around your partner. For example, hug your partner, as it were. So you try to gently tighten again, close that hole, and gently lift up. And again, we don't want to hold our breath. We want to be able to keep breathing and then relax. And then we move towards the front. So we're really focusing on where we pee, and we're trying to gently tighten just behind the pubic bone. Just behind the pubic bone, gently tightening and pulling up, lifting up. And again, you should feel this is a little bit of tightening in your lower abdominal wall. And relax. So ideally, we should be practicing those. Ideally, we should be practicing these 3 times a day, and we should be trying to hold the contraction for 10 seconds. Now, if you don't make 10 seconds, that's fine. And make sure that you fully relax after the contraction, so you can really tell the difference between if you're contracting it and if you're not contracting it. So 10-second hold, and then try to do 10 quick contractions of it. So it's like if you're imagining like you're winking your pelvic floor, you do 10 nice good scrunches and good winks and good lifts. And if you can do 10 in 10 seconds, that's great. Maybe you could set yourself a little task of timing yourself doing 10, see how long it takes you to do 10 full contract and relaxes, and see if you can get that time down over the days. And again, this should improve dramatically over a 2-week period. If it's not, then you should again see a physiotherapist who does work with the pelvic floor. There are other assistive devices that some people will use as a biofeedback, so something that you again insert into the vagina that can measure how much you're contracting those muscles. And again, a pelvic floor specialist will be able to advise you a little bit more about this and give you a bit more advice around that. So pelvic floor for life. If you've had a vaginal birth, you are in a very exclusive club, which is the Pelvic Floor for Life Club. So if you're having difficulty remembering to do your pelvic floor exercises, I suggest you think about something that you do 3 times a day, breakfast, lunch and dinner perhaps, and team it up with that. So every time that you have a meal, maybe that's the time to remind yourself to do your pelvic floor exercises, or if you're in a car, that again could be a good time to do your pelvic floor exercises. Stop at traffic lights, don't cause any accidents. Diastasis recti. So this is a separation of the tendon, which is called the linea alba, of the 2 bellies of the rectus abdominis muscle. So it's a 6-pack muscle down the center of the stomach there. It looks like a little bulge or a hernia in the midline of the abdomen, which is accentuated when you're doing any action that puts strain on the abdomen. So if you're doing an abdominal crunch and you see a bulge down the center of the stomach, you might have that diastasis. Again, you might be able to put your hands inside of that. It might be a significant gap, especially early on after having a baby. You might get a glimpse and look down as you're doing a plank hold, for example, and you might look down at your stomach and again see a little bulge coming out through the middle there. So this is what we're wanting to try to manage. It can just be because you've had a very large baby, multiple children, multiple pregnancies. the abdominal muscles stretch, can only stretch so far, and then they're going to start to separate. Doing unsuitable abdominal exercises during pregnancy can put you at risk of this as well. So these are mostly doing things like going into an abdominal crunch and then doing oblique twists. So oblique twists are not great. It's okay if you're just doing some rotation in a straight position for stretching, but not in an abdominal crunch position. And likewise, if you're getting up out of low chairs, sitting up out of bed, and again, not trying to contract your abdominal muscles whilst not actually being able to contract them well because you've got a great big baby in your belly, then again, you may put strain on those muscles and cause them to separate. So things like making sure you roll onto your side and push up with your hands to get out of bed, using your arms to help you get out of low chairs, leading right the way forward before you try to get up out of low chairs. So you can use your legs, are really important as well. But you can do some self-assessment, or again, you can get a physio to assess this for you to help you identify specific areas that are more open in that separation, and to see if you can actually minimize this by effectively contracting your pelvic floor and deep abdominal muscles. So I'm going to just play this little video, hopefully it works, which is just me. I do have a 1 to 2 finger separation around my navel, and again, I managed to manage that pretty well. Sometimes they won't completely close, that's fine. It's about it being for functional stable. So if we can see that these separations actually come together when we contract your abdominal muscles, then that's a good sign that you can kind of carry on with doing those exercises and building them up. Don't think I can make it any larger, unfortunately. So, play. So basically, you're lying down on your back with your knees bent, and then you're just going to support your head with one hand. You're going to feel your abdominal muscles right down the center line, starting sort of from a centimetre or two below your breastbone, and then holding that position while you do a little abdominal crunch. And when you do an abdominal crunch, you're going to feel the tension hopefully in those upper abdominal muscles, and then you're going to try to feel for the little dip of the muscles either side. And then when you find a point that's got a greater separation, then you can measure that with your fingers. So 1 finger is quite normal, 2 fingers is you have a diastasis, and 3 or 4 fingers is obviously a little bit more severe. And again, it's quite normal to have 3 or 4 fingers straight after having a baby, and it might mean that you might have a 2-finger separation or 3-finger separation sort of further down the track. You should feel all the way down towards the pubic bone as well. It's the most common spot, and the sort of point of weakness seems to be around the belly button. And then once you've identified that, that separation, you want to keep your hand on it. You want to then activate your pelvic floor, so tightening and lifting the pelvic floor, tightening the lower stomach or drawing it in towards your spine. You see what my son looks at on YouTube here. Lots of Minecraft. So you can then tighten your pelvic floor and abdominal muscles, and then perform your abdominal curl up position again, and see if you've been able to successfully reduce that separation. If it's very, very early days and you're not really, like say within that first 4 weeks after having a baby, and you're not really, doing abdominal crunches at this stage is not really that helpful for you. It's just about trying to see if you can keep practicing that pelvic floor contraction, see if you can actively narrow that corset, that internal corset around the waist, and see if you can actually draw those 2 sides of the rectus abdominis belly together whilst just lying on your back. You can also monitor that while you're doing leg exercises, so that might be lifting your legs up into tabletop position, and then again just monitoring that that separation, and just checking that again that doesn't increase as you're doing sort of leg exercises. And again, remembering to use your pelvic floor. So the pelvic floor muscles activated by the same nerve that activates your transversus, or your deep abdominal muscles. And your deep abdominal muscles is just like your internal corset, and they will just help to knit those that rectus abdominis muscle back together again. So it's really important to do the pelvic floor first, and then to imagine like you're actually physically drawing your pelvic bones together at the front and sort of knitting that separation back together again. You can also think about drawing your rib cage again narrower, and drawing your rib to your opposite hip or the opposite side of your pelvis to again contract these. Again, in terms of isometric contractions with those abdominal muscles, a good thing to try early on is just having your placing one hand against your opposite knee, inside of your opposite knee, and then just again gently pressing your hand against your opposite knee. And you want to try to feel a bit of tension under the rib cage. So if you're pushing your right hand against your left knee, you want to start to feel a bit of tightening in the right side of your rib cage as you're activating your oblique muscles as well. So that's what I mean by isometric contractions. Or again, you might just put your hands on top of your knees and press your hands down against your own knees to again gently contract your abdominal muscles. So like you're trying to crunch, but not quite going into that movement. Obviously, if you overload this and do too much too soon, you could make the separation worse. However, it is a muscle, and muscles do respond to load, and so doing nothing will certainly not make it any better. And as again, I say, as long as you're able to maintain that position, it doesn't separate worse when you do abdominal exercise. It's really important to load those muscles to force them to remodel and strengthen and knit back together. Going on to posture. Then we're coming to near the end. Posture is a thing that really affects a lot of women. You've got all this laxity in your body, still got relaxin in your body for up to 3 months after finishing breastfeeding. So relaxin is the hormone that helps to loosen up all your ligaments in preparation for childbirth, and it's still flooding your body afterwards as well. So, you know, really bad posture can affect you even worse than normal. So shoulders are a big thing, neck and shoulders. I know looking, if you're breastfeeding, they're so adorable. You want to just look at the baby breastfeeding all the time, but it doesn't do anything for your neck. So try not to spend too long with your head down looking at your baby. Use pillows, prop yourself up, have a good nursing chair. You know, it's a lot of hours spent in a day in this position, so don't take any shortcuts. Flat feet, so a lot of women find that their feet get a bit wider or a bit flatter, and they start to feel pain under the balls of their feet, especially as a result of that. So wearing good footwear around the house is really important, and good footwear when you're exercising to help support the arches of your feet, and there are exercises that you can do to strengthen them as well. And then the unflattering mum bum. So this is a phenomenon that tends to happen quite a lot after having babies. We can see the pancake bum versus the peaches. So the difference with the pancake bum is that the back is quite flat. There's a loss of the what we call the natural lordosis, which is the natural arch or curve of the lower back. The pelvis is in what we call a backwardly or posteriorly rotated position. And this puts your butt muscles in a really bad position to work, and it also puts your pelvic floor muscles in a short position, which also means they don't work that well. And it can also put a lot of the weight of your organs, your uterus, your bladder, and your bowel, all straight down onto the pelvic floor. Versus in the peaches, we can see that she's got a really great shaped butt. She's got a natural curve in her lower back. She's got good strong back muscles there. You can see she's got a natural forward tilt of the pelvis. So this is going to rest the weight of your organs and all your guts on the front of the pelvis, a little bit more onto the pubic bone with a bit of a backstop. And it's also putting the pelvic floor muscles into their mid-length, which they will be a lot stronger in as well. So how do you avoid the pancake bum? Adjusting your pelvic position is really important. So again, watching for prolonged periods of time sitting, which can again cause you to get too rounded in the lower back, and also obviously don't use the bum muscles much when you're sitting, apart from to sit on as a cushion. But some things like if you're standing up, then just sometimes slightly leaning your weight forward into your front of your feet can help you to just gently tilt the pelvis forward. And just thinking about as if there's a little drawstring going from your tailbone right up through your spine, and somebody just pulls that drawstring up and just starts to sort of pull that tailbone out from between your legs. And this will put your pelvis into a slightly more neutral to forward tilted position, which is normal for females to have a slight forward tilt in their pelvis. Again, I see a lot of women who have once had quite a big arch in their back, so have learnt to diligently tuck their bum under, only to end up too far the other way. It can also develop if you have quite a sway type posture, if you're a very tall, lean type of person. But again, when I see this, it tends to indicate that yes, the butt muscles aren't working very well, and potentially the pelvic floor muscles aren't working that well either. So slightly tilting the pelvis forward. Think about that when you're exercising and running. Avoid sort of getting the pelvis too tucked under, unless of course you are the other way, where you actually do have a great big arch in your back. Then obviously this might not apply to you. But again, having someone assess that and look at that rather than just assume can be really helpful. And then lots of good buttock strengthening exercises, and we're going to cover a few in the next slides. So just with some considerations for returning to sport. Relaxing, as we talked about, can stay in the system if you're still breastfeeding. So just being aware that you might not be able to withstand high impact stuff, building that up too quickly. Ensure adequate hydration. So women need more hydration than men anyhow, but if you're still breastfeeding, then you will need even more. So equating how much water you need for breastfeeding, how much water you also need if you're sweating and exercising is important. Again, minimum of 6-week recovery before resuming high impact exercise, even if you've had a vaginal birth. I would recommend, because you still need all those insides to stay inside of you, those pelvic floor muscles to recover. But this is particularly important if you've had a cesarean. Swimming can be resumed if you've stopped bleeding and had adequate pelvic floor muscle control. And just again, be patient. Allow 9 to 12 months to get back to pre-baby condition. I found with my cesarean, it took me about 9 months before I felt like I was really kind of back to normal. And with second baby, which was a vaginal birth, I started my Run Every Day challenge at about 4 months post him, and I did my first half marathon about 7 or 8 months after him as well. And again, it's a continual process. So I've had lots of fun with pelvic floor strengthening as a result of that, and it was something that I had to manage. It just keeps getting better and better as time goes on through continuing to strengthen. Now, just an example, because I do work with a lot of runners. For example, if you're returning to running, you know, from 3 weeks, you should be working on pelvic floor exercises, basic lower abdominal exercises, which will be in our upcoming program, glute strengthening, body weight squats, doing some cross training, which might be sort of walking or using a cross trainer, or swimming, or cycling, doing step ups and 4-point kneeling exercises. So those are ones like on hands and knees, taking the opposite arm and leg out. You know, aim to be walking regularly, building that up to a brisk pace by 6 weeks for vaginal birth, or starting that at 6 weeks from a cesarean, and then trying to start your walk jog program from 6 weeks for vaginal birth or 8 weeks from cesarean. Again, if you were really super fit and you're able to keep running, for example, right up to sort of the last few weeks of your pregnancy, then you know you may very well be able to get and progress into your walk program, your running program, much quicker. But again, I'd still probably recommend that sort of stand down time, because it's really hard to go backward and repair the damage. Just a few more weeks can give you that much more recovery time. So for example, week 1 might just be walking for 5 minutes, then jogging a minute, and then walking 2 minutes and repeating it for 5 or 6 times. And you can see those times start to progress as the weeks go on. And again, it's just reminding yourself that all of these muscles, your abdominal muscles, your pelvic floor muscles, your hip muscles, just like everything you're wanting, they will fatigue, your technique will go bad, and you'll set yourself up for injury. So you do need to take it, progress, and begin to give it a minute at a time. When you're jogging, we underestimate how much impact running is on the body, which sometimes you only really appreciate if you've had some laxity into your ligaments. And then gradually progressing to sort of 5 or 6 kilometres, 3 to 4 times a week is good. And it's just about having consistency, really. And if you're consistent with your training, and your body will adapt, you don't really want to fluctuate too much and having really big weeks and then nothing for a week and stuff like that. So you want your body to adapt and maintain. If, of course, you're experiencing any problems at 1 week, drop back to the previous week's program and continue with that for a little bit longer. And don't neglect, again, once runners especially are terrible at doing home exercises and stretches, and once they're past an injury and allowed to run, everything else goes out the door. So remembering to keep doing your strengthening exercises, your abs and your glutes, especially, and stretch after. So just finishing up, I can, again, I'll have the recording of this available, but I'll also just sort of post these exercises, link to these exercises out. If you just email me, karen@peakpilates.co.nz or millward@peakpilates.co.nz, reply to the email that comes in the post webinar email, and just let me know if you do want me to send you these exercises through. But looking at that sort of early stage, so sort of from sort of week 2 or 3 to week 6, we've got your basic pelvic floor contractions. We've got the stretching of your thoracic spine over a pool noodle or a rolled up towel, pelvic tilts, the bent knee fall out, your heel slides, and again, monitoring if you've got any separation, monitoring that you're not doming or arching in the back and you're maintaining a neutral spine. The cat-dog stretch, happy cat, angry cat, some clamshells for the glutes, and some pelvic bridges. So again, once you're sure you can do a pelvic floor contraction, you can do glute bridges. We just got to watch out for any exercises where you are kind of where your pelvis is going up higher than your head and your shoulders. If you don't have good control, because you can sometimes take a bit too much air into the pelvis if you can't maintain a pelvic floor contraction. Not a good idea. So it might be 2 or 3 weeks after that you start bridging. And then moving on to some more challenging exercises. Again, sort of in the weeks of 4 to 6, you might start doing some bird dog or swimmer exercises, start lifting 1 leg to tabletop, doing the next stage of event knee fall out, which is with 1 leg in tabletop, doing some leg lifts, single leg lifts, and possibly some circles. Again, from sort of 6 weeks onwards, you might start to bring in some upper abdominal crunches, maybe some oblique twists with that, again, as well, if you've not got too much problem with the diaphysis. Starting to bring 2 legs up to tabletop. If you've got control with that, moving on to single leg stretches. Going on to marching bridges, being really good for those buttock muscles. Side planks, again, your buttock exercises, the pendulums, circles, some inner thigh squeezes, so especially if you've had some problems with pubic symphysis instability, doing some inner thigh squeezes with the leg straight and with the leg bent can be good, and holding those contractions can really help to ease any pubic symphysis discomfort. Doing an inner thigh stretch afterwards. Going into planks, again, managing any separation of your abdominals if that's needed. Doing some upper back work, again, for posture. A book opening stretch, which is great for just stretching the chest muscles if they're a bit tight, rotating and mobilizing the spine, building up the legs with some wall sits, and you can progress down to 90 degrees if you're comfortable with that, adding in calf raises. and then doing a backward lunge or single-legged squats in those later stages. Of course, there's a lot of other sport-specific exercises that you could get into if you've got specific needs, and again, it's worth just talking to physio or your trainer about these to progress you into them. Again, I wouldn't go straight, so it's just things like, if you're doing lunges, you're going to start with some static lunges, holding on to something for some support, really focus on your technique. You're not going to go into jump lunges straight away, not going into sort of box jumps and plyometrics, just starting with those static controlled exercises, building it up and progressing in a continuum